Hi, my name is Brian Hill. I am a physical therapist and owner of Rehab United Sports Medicine and Physical Therapy. And you're about to watch some videos we made for you because you've recently had a hip surgery and we want you to get back on your feet and walking in no time. So take a look at these, and if you have any questions, feel free to reach out to us. The heel slide is a great exercise to gain range of motion at the knee and the hip. We're going to lay down, we're on the bed or table, and we're going to slide the heel up as far as we can. Initially, we're going to feel stiffness, tightness, but we're just going to go slow in that process, slowly gaining range and returning. So we're bringing that knee up as far as we can without significant pain, and then back down. That is called the heel slide. Part 2 of the heel slide, or maybe even part 1, when we don't have the muscle strength to do this slide on our own, we're going to take a belt or 2 belts together or a long beach towel, wrap it around the foot, and what we're going to do is we're just going to slowly pull our foot up to gain range. This is passive range of motion, getting motion at the knee and or the hip. And we're going to repeat that several times, 10 to 15 reps, maybe 3 times in a row, or do it till you're fatigued, and then take a break and then repeat. So we're going to do a bridge exercise. So the bridge is going to engage the core and the hips. So we bring both knees up to a comfortable level. If we had knee surgery, maybe we're down a little lower. We're going to squeeze the hips and then lift our hips up into the air and hold and then back down. So this is a bridge. And then our variations are left foot in front with right or right foot in front, either or. Wider, toed in, toed out, or again, right foot in front, toed in, toed out, left foot in front, toed in, toed out. And we're going to do a bridge in all of those positions to engage that hip. That also lets us get lateral, side to side, to get in and out of bed. This is the straight leg exercise. So we're going to use the quad and the hip flexor to start firing them. It's usually easier if we're laying down with the opposite knee up. We're going to use the quad set where we tighten that quadricep. We're going to bring the toes up, elevated, so we're keeping everything stiff, and then we're elevating the foot. Many of you watching this will actually struggle with this and you'll have a bent knee. That's fine, we're turning the hip on, but our long-term goal is to keep that knee straight with the goal of lifting it at least to the height of the other knee and then relaxing. It's much easier with the head down. And initially you could have someone with their hand underneath you helping you a little bit, and then progressively getting more functional with that. So the second portion of the straight leg raise is the lateral movement. So we can come out to the side. Often we can slide the heel to start. This is letting us get ready to get up off the table or the bed. So we lift and bring that hip out. That gives you the lateral movement of that straight leg raise. And we want to do 3 sets of 10, or we're going to do till fatigue, take a break, and then repeat that pattern. So we want to also turn on the hip on the outside. So we'll lay on the side with the hip surgery up or knee surgery up. So that means my right knee is the surgical knee, or right hip is. And what I'm going to do is I'm going to lift the leg up in the air. I can be propped on an elbow, or I can be laying down. And then I'm going to come up into the air, hold that position, and then return. So I need to engage that glute, fire that before I lift, and lift that up and repeat. So we want to do several, 3 sets of 10, or repeat this till we're fatigued, take a break, and then repeat again.